Hey everyone, it's Raj from 3CB. Leicester City center back Wesley Fofana suffered a significant left lower leg injury due to this scissor tackle in a preseason friendly. Based on the video mechanism of injury, this was either most likely a distal tibia fibula, the lower leg bones fracture, or a fracture dislocation at the ankle. Based on further details from pictures in which you can see what looks like a break near the shin area, this is most likely the former. The player was stretchered off in clear pain and taken to the hospital for assessment. The key things to look out for would be whether this is an open fracture, which can significantly increase the risk of infection, and then further if there's any artery or nerve damage. The player will be headed into surgery to stabilize the injury, and in the case of a distal tib-fib fracture, that's usually done with an IM rod and screws. In terms of return timeline, if this is a tibia fibula fracture, the typical return to play here is around 6 months. If it is, however, an ankle dislocation fracture, then that's roughly around 3 months. A very notable example being Everton's Andre Gomez. The key confounders there that we don't know are what I mentioned before in terms of artery nerve damage and or open fracture, which can lead to higher rates of infection. Both of those can significantly extend the return timeline and return to performance. In terms of post-injury performance, if Fofana has a relatively straightforward injury, then there's no reason he can't return with appropriate physio and strength and conditioning. It's a long road ahead for the player, and I'll keep you updated as we learn more information.